Dr. Rupal Patel, I know him since last year, a good friend, and basically he is working in VCU Health Orthopedic System. He is an orthopedic surgeon. Now, currently, he has started seeing patients in short pump area, and he has moved down to Colonial Heights and Chester area. The short pump area is starting, if I'm right. I think this month he's starting.
I started in February.
February, okay, sorry, in Feb. So, and then his affiliated hospitals are MCV, Chippenham, Southside Regional Medical Center, and John Randolph Hospital. And he's also an assistant professor of orthopedic surgery in VCU Health System. So, Dr. Rupal, I'm going to mute myself and you're going to take over from now.
Hi, good afternoon, everyone. As Mr. Ramki Kawasari said that I joined VCU about 12 years, in 2012, so about 7 to 8 years ago. And then basically from this February, I joined the group called Colonial Orthopedic, which is more in Colonial Heights area. So that's where I practice, and my primary area of practice is orthopedic joint replacement, hip and knee. But when I'm in Colonial Heights area, I do general orthopedic as well. So we can go ahead and talk about all the joints and different problems of different joints. I'll start with simple things, starting from the wrist and hand problems. With this coronavirus pandemic, when patients were not able to get into the clinics very easy, and they were also afraid of going to the emergency rooms because of getting fear of getting contaminated, we saw, or I have heard from a lot of patients, they fell at the home or something, and then they started having wrist pain. So when you fall and injure the wrist, it can be either the sprain, or you worry about whether it's broken or not. So if you see minimal amount of swelling and no any deformity around the wrist, or you do not see any ecchymosis, which is kind of subcutaneous blood, then it's mostly sprain. Sprain is basically injury to the ligaments. In that situation, if you cannot go to the doctor, first thing I will say, you start with the RICE. Basically, RICE is R-I-C-E. You start with the wrist. You try to modify using that arm. Do not use much. Apply the ice. That helps with inflammation and swelling. You can take the medication like Aleve, which is naproxen, or ibuprofen, which is Motrin. They are available over the counter. That helps with swelling as well as pain. And most important thing is if pain is still not controllable, you can use the brace, as you can see on the top right corner of the screen. That brace is easily available at either Walgreens, Walmart, CVS. Even if you go to the doctor, if they give you the brace, they're more expensive than just buying through on the over-the-counter Walmart. Last time I checked, they were ranging about $15 to $20. So they're very cheap. You can use that and they will help with your pain. If you see much more swelling, deformity of the wrist, then you want to go ahead and call a doctor, or you can go patient first. They can do the x-ray, and depending on if there is a fracture, they will ask you to go to the orthopedic specialty. Otherwise, they can manage it just with the brace and all like we talked. The second very common problem around the wrist and hand is a carpal tunnel syndrome. More common after age 55. That's when a lot of patients will say their hands are getting tingly or numb. That happens mainly because there is a nerve called median nerve get pinched at the wrist. And that nerve supplies, as you can see on the right side picture, mostly 3.5 fingers. And the symptoms are, if you are doing repeated activities, the symptoms will get worse, like typing. Even some patients said while driving, my hand gets numb and I have to shake it. And that helps with the numbness. It also wakes you up at night because most of the time when you sleep at night, you sleep like this, and basically it increases the pressure at the wrist and causes the symptoms worse. And there is a test, as you can see the bottom picture, where we ask patient to hold their arms like this. Basically, we are increasing the pressure at the wrist. And the nerve get pinched further and patient get more symptoms there. That's kind of confirmatory test for the carpal tunnel syndrome. So if you have carpal tunnel syndrome, and that sometimes can happen during pregnancy as well, where there is a more fluid in the body, they will get more pressure of the nerve. Patient with diabetes, patient with thyroid, they also get this kind of problem of carpal tunnel syndrome. The treatments are basically three treatments. When you have the symptoms which are not really severe, you start with the brace, just the same brace where you can see in above picture. That brace, what does it do? It will prevent you from causing this movement, and it doesn't increase the pressure if you wear the brace. So if you sleep with the brace at night, it doesn't wake you up. And initial symptoms, I have seen a lot of time, if your swelling improves, inflammation improves, the symptoms can improve itself, but just with using the brace. If they continues, then you might want to go ahead and call the doctor, and they can go ahead and run the test called EMG, or nerve conduction study. That's basically diagnostic for the carpal tunnel syndrome. You don't need it actually. It's clinical diagnosis. Sometimes on the base of clinical diagnosis, you can treat it. And the other two treatment, when you go to the doctor, they will talk either about doing injection, which is cortisone injection, a steroid we can inject right at the wrist. That will help with the inflammation and swelling around the nerve, and that will help with your symptoms. It helps about 30 to 50% of patients, the symptoms get better and they might not need further anything. If it doesn't improve, if it keeps going further, then a doctor will talk about the surgery. Basically, it's a simple procedure, takes about 20 minutes to do the procedure, outpatient. They will go ahead and make about 1 centimeter cut there, release that nerve, and most patients says that the tingling, which is pins and needle sensation, that goes away within couple days. They are pretty happy, they can sleep well. The numbness, that takes longer time to recover. If you wait longer before your treatment, then it will take longer to recover. But this carpal tunnel is very common symptoms. So if you are experiencing any tingling or numbness, you start thinking about having carpal tunnel syndrome. We'll go to the next problem of the wrist and hand, which is, it's called, it has a fancy name affiliated with it. It's called DICAR1 tenosynovitis. Basically, there are tendons which goes through a tunnel here, goes to the thumb. So with certain thumb movements, you will experience pain there, which is shown here in the red area on the left, where you see that's where most patients will experience pain. Pain worsens with repeated activities. There is a classic test which has been described in the picture. If you bring the thumb inside the palm and then try to bring the wrist down, you will experience aggravation of the pain. And that's basically inflammation of tendon. The treatment is pretty same. You basically start with ice that will help with inflammation, use anti-inflammatory medication, which is again, Aleve or ibuprofen. Brace here is important, as you can see on the picture. This brace will include the thumb as well. That helps with immobilizing the thumb, and your tendons will get some rest. That helps with the pain. If symptoms does not improve with these issues, basically you go ahead and talk to the doctor, and sometimes they do the same last two options, either do the cortisone injection. Here, injection helps more often than it does for carpal tunnel syndrome. For this problem, doctor can inject right where the tendon is getting pinched underneath the what we call fascia, and if it helps with inflammation, the symptoms can improve. And at last, normally we like to wait almost about 6 months to 1 year before we talk about surgery. But if needed, again, simple procedure, outpatient, just takes about 20-25 minutes to do the procedure. We go ahead and make about 1/2 to 1 inch incision right at the wrist and release that tight band over the tendon, and that will help with your pain. So this is also very common problems. It can be sometimes confusing with the basal joint arthritis of the thumb, where you will have pain a little bit more towards the thumb compared to where you had before at the wrist. This is very common after age 55. Actually, we see this problem even more common than knee or hip arthritis. Uh, Here, the treatment is you take anti-inflammatory medicine or Tylenol arthritis that helps with the pain. Again, limit the use of that and use the brace. You can use the same brace which has been shown in the picture. Again, last time I checked at the Walmart, at the aisle next to the pharmacy, they carry this kind of brace, and these are a little bit more expensive than the previous brace. Runs about $25 or so, but that definitely helps. The brace, I would say that helps more in hand and ankle than that will help in the knee or anywhere else. So brace has some role in the hand problem and wrist problems. Again, same treatment. If symptoms does not improve with the ice, anti-inflammatory medicine, change in activity, and using the brace, then you go ahead and call the doctor, where they can either do injection. If symptoms get really bad and x-ray shows the joint has completely worn out, then there is a surgery for that. Another very common problem in the hand is a trigger finger. Trigger finger is basically your finger get locked and you have to actually trigger it to open. And your pain is classic at the base of the finger. Any finger, it can affect any finger, including thumb, but your pain will be mainly at the base of the finger. As it worsens, finger actually get locked as you make a fist, and then you have to click it open. That's why it's called trigger finger. Same pathology, basically there is a tight band here called A1 pulley. Basically tendon goes through that. When it's tight and inflamed, it will grab the tendon, so you have to click it open. It's very painful. This is very common problem patients come, and it's very common after, again, age 60, 65. But if that happens initially, you can try massage and ice. Sometime inflammation go away and it can help with the pain. Next thing is same other two options. If pain keeps getting worse, injection can help. Doesn't help as good as any other issues, but there is a possibility helps with the pain, may not help with the trigger. And this is very simple fix. If it keeps going, you will think it's just the finger, but it's bothering so much to the patient, and they easily get ready to get the surgery done. And it's very common surgery we do. It's about 1/2 inch cut right at the base of the thumb. We go in and release that fascia, which is pressing on the tendon. And that helps immediately. Patient in recovery room will move the finger and it doesn't catch, doesn't hurt. They are very happy. So I ran over all or most of the common problems I see patients with, including wrist strain or distal radius, which is wrist fracture, carpal tunnel syndrome, the tendon inflammation at the wrist, arthritis of the thumb, and trigger finger. Most of the time you will have either of this problem, and I will be easily available. If you have any issues, I will be happy to share my number. Now we will switch gears and we'll go to the foot and ankle problems. Similarly, like a wrist sprain, we see more common of ankle sprain. People just walking in the yard, uneven surface, they can get twist the ankle and they can sprain that ligament. Mainly it's an outer side, or what we call lateral side of the ankle, where their pain and swelling starts. If you see any deformity or swelling is significantly more, then you worry about fracture. Otherwise, sprain is very common. Same treatment, it's called RICE. Again, you try to rest, apply ice, elevate the leg. That helps with the swelling a lot. You try to use anti-inflammatory medication, again, Aleve or ibuprofen. Same way, ankle support brace, as you can see on the picture. Some pharmacy carries those in Walmart, CVS as well. But as I have seen and researched, Amazon, they sell it very cheap, and you can have different variety. You can just order from there, and that's a brace that's going to help. Sometimes if swelling doesn't go away, pain is worse, then you might have to call the doctor and they can check, they can do the x-ray. If there is no fracture, they can give you the cam boot, as you can see the picture on the right. That cam boot is also available buying online. Most pharmacy don't carry, but if you see it's not deformed, pain is not too bad, but it's lingering around, doesn't improve, you can just go ahead and buy that cam boot. And that can come handy anytime you sprain or your friend sprain the ankle, you can use those. If pain is more swelling, you see some ecchymosis, which is again subcutaneous bleeding, and there is a deformity, there might be a fracture, you might want to see the doctor. Easiest way to get into is patient first or somewhere. They can see you, they see a lot of ankle sprain or simple fractures, and they can give you a boot. If they consider you need to see someone orthopedic surgeon, they will definitely refer you, and then your problem might be a little bit more, where you might need either cast or surgery. Talking about the foot sprain, small fractures in the foot or the toe fractures, basically these problems, even though you worry because they get swollen, it keeps hurting for longer, but you can a lot of time avoid going to the orthopedic surgeon, giving them unnecessary copay and wasting your time. These fractures or sprain, they are almost 80% or 90% time treated without surgery. So if you sprain the foot, you will have pain, swelling. Do the same thing, apply ice, elevate the leg, and use the boot, or as you can see, the sandal kind of boot on the side, right lower corner. You can use those if you have a injury to the toe, whether they are broken or not. If it is not too much deformed, they are also going to treat it without surgery. So you can buddy tape it like it shows on the picture there, and apply the sandal kind of shoe, which are easily available online or in the stores, pharmacy. So use those and save your time as well as money, because most of the time they are going to get treated without surgery. We'll go to the next problem, which are both very common, very painful, very annoying, but none of them requires any surgery. One is Achilles tendonitis, which is inflammation of tendon on the back of the ankle, as you see the picture on the top, where the tendon which attaches to the heel bone, that gets inflamed. The treatment is any inflamed tendon, it's gets started treatment with the ice, taking anti-inflammatory medicine, and supporting it with a brace or something. Very important thing for this kind of problem is a stretching exercise. So basically you have to stretch that tight tendon and relieve some inflammation from there. There are pictures of stretching over there. You can try those. Excuse me. Similarly, the plantar fasciitis or heel spur, where pain is here at the heel, bottom of the heel rather than back of the heel, where you will have excruciating pain. Most patient complaints pain is worse in the morning, because here the problem is the band, as you can see here in the picture, that white band underneath the bone, that get tight and inflamed, and that start pulling on the bone. So sometimes you see the spur if you get an x-ray there. You get excruciating pain there, and treatment is using the ice. But here, if you use the frozen bottle, you put the water bottle in the fridge, make it frozen, and then roll your leg over that bottle. They will stretch that tight band as well as give you some ice effect. So that helps. You can stretch over the tennis ball, or you can just pull toes, and that stretching. Here the treatment is stretching, stretching, and stretching. That's the most important treatment. You can put some gel pad that support that pressure over that tight origin of the fascia. A lot of time this may become so annoying that you have to go see the doctor, and next treatment they can sometimes do injection of cortisone there. But again, as the treatment is stretching, in Achilles tendonitis and plantar fasciitis, physical therapy has a big role and they can help you with the pain. So if it keeps going, if it keeps hurting, you can talk to your primary doctor. They can refer you to physical therapy. None of this situation requires surgery. It's very rare that you will do surgery for plantar fasciitis, but they are self-resolving. They are going to get resolved if you keep doing stretching really religiously. We will now come to the larger joints, talking about the shoulder pain. This is very common problem as well, mostly in older age, where they either get the frozen shoulder, they get bursitis, or what we call impingement syndrome, and very rarely the sprain or injury. I see a lot of patients with the shoulder sprain while they try to pull their lawn mowers starter. So that's another mechanism of injury. You fall and you get injured the shoulder. Shoulder is very common joint. If you don't start moving, it can get freeze, what we call frozen shoulder as well. So a lot of time patient comes with the complaint there that movement has decreased. Male patient usually will say they have difficulty reaching their wallet on the back pocket or putting the belt in the belt notch. Their basically signs are patient is unable to raise over the head, and the pain can be worse at night when they sleep on that shoulder, so it's difficult to sleep on that side. The treatment, again, most orthopedic problem, the treatment starts with either ice or heat, whatever is helping in the shoulder area. Use some anti-inflammatory medicine. I have mentioned all these over-the-counter medicines. Exercise is very important in shoulder problem. So if it is not major injury and if it's just causing pain and limitation in movement, you want to keep moving that shoulder, otherwise it can easily get froze. Very common problem in patient with diabetes or thyroid, they get frozen shoulder. Simple exercises include what we call a wall walk. Basically, you go to the wall and try to move your finger and try to raise your arm over there. Corner stretch, you go to the corner and try to stretch your shoulder muscles over there. Just movement exercise, you try to touch your other side of shoulder. That's another simple exercise. Most shoulder problem, unless it's injury or really a rotator cuff tear, which are the muscles around the shoulder, they get treated with either anti-inflammatory medicine, ice, and exercises. So physical therapy has a big role here in shoulder problems. If problem continues, basically you call your doctor. Few primary care providers are comfortable with doing injection in the shoulder joint. So either you can go there or get referred to orthopedic surgeon, they can put the injection. If pain continues after all these problems, then basically x-rays and MRI are done. If MRI shows that you have a big tear in rotator cuff, they can talk about arthroscopic surgery where we can go in with the cameras, make just 3 simple keyholes and fix your rotator cuff. So these are the common problem with the shoulder. We will, these are the exercises I was talking about. Stretching and movement exercises are very important for the shoulder. We'll switch gears to the knee. Very common problem here. They can start as early as age 30, and these days with the kids start playing competitive sports much earlier and all that, we have been seeing more problems starting at age 30, 35. Most common cause after age 40 is osteoarthritis, but younger kids, they can sprain their knee. Meniscus tear is very common problem. Sometime if no injury and all of a sudden if your pain get worse, it can be inflammatory problem like gout. And if you have major injury, you can have rupture in major ligament like anterior cruciate ligament or collateral ligaments. The symptoms again are pain. If your pain is front of the knee, it's more arthritis of the kneecap. If pain is on the inner side of knee and worsens with twisting, it can be the meniscus problem. If you get some instability walking and you say knee gives out, sometimes it can be either ligament injury or just a simple meniscus tear. If it depends on activity as well. If pain is worse with going up and down stairs or coming in and out of car, it's more commonly your kneecap arthritis. If pain is mostly from walking uneven surface, it can be overall arthritis or meniscus tear. You can feel some crepidus in the knee as well. And the treatment, again, we can start with same thing, ice or heat, whichever helps. Arthritis, heat helps more because as you might have heard in the past that some people will say they will know when it's going to rain because their knee started hurting. That's because of the osteoarthritis. If it is injury, you want to apply the ice. Take some over-the-counter medicine. There are simple exercises called quadriceps strengthening exercises. We'll have those in the next picture. But those exercises can help with the arthritis pain. If it keeps going despite of all this treatment, injection helps pretty good. It can, if you do cortisone injection, that can help about 3 months of pain relief. There are some gel injection. For the younger patient with not too severe arthritis, we can inject synthetic joint fluid, or some people call it gel injection. That can help lubricate your joint and help with the pain. If symptoms are very worse, then you see your orthopedic surgeon where they can do X-ray or MRI and come to the diagnosis, either arthritis, meniscus tear, and further treatment can be done depending on your problem. With the knee, after treating with all this conservative treatment, if it keeps going and if you have severe bone-on-bone arthritis, knee replacement can be treatment. With the meniscus tear, there is a simple procedure, goes with the arthroscopy, small keyholes, we put the cameras in and trim off the meniscus or repair the meniscus. That can help with your pain as well. These are some simple exercises. We'll go to the back pain. It is very common problem, can occur at any age. Most of the problem in younger age, they might be muscular pain or muscle sprain related pain. Sometimes they can be the herniated disc or pinched nerve in the back. In the older age, the degenerative changes, which is wear and tear in the back, can cause the pain. All these problems, if any of the back issue is related with the pinched nerve in the back, you might get pain radiated to your hip and thigh. Sometimes goes up to the leg and all the way up to the toes. You sometimes can get tingling or numbness in the toes. That's because of your pinched nerve. If nerve is getting pinched really significantly, then you even feel weakness in the leg, your muscles are weaker, and sometimes you can get urinary incontinence as well, which is difficulty to hold the urine. Another common problem, what we call sciatica pain, you might have heard about it. Sciatica pain is pain right in the back of the hip, goes on the back of the thigh, radiates to the leg and around your big toe. That's the sciatic nerve. That's also coming from your back. You might have pinched nerve in your back or hip area, causing this significant pain. Sciatica pain can be treated, or most of the time treated, without surgery. It's very important to know about it. When you get sciatica kind of symptoms, if your pain radiates from hip up to the toes, you start with the heating pad, apply heat around the hip area. The main treatment is exercise, exercise, and exercise. Basically, you do stretching exercises for there. Physical therapy can help you with that. That helps with the releasing pressure on the nerve and help with the pain. You can take anti-inflammatory medicine. If pain is severe enough, then a lot of time you can call your primary doctor. If you describe your symptoms, they will know that it is sciatica. They can prescribe prednisone, which is a steroid, for the shorter duration, about week or 2 weeks, and that will help your pain immediately. Muscle relaxers can also help, but those both are prescription medicines, so you will have to call your doctor. Again, if you go to your primary doctor or orthopedic surgeon, first thing they will start is these medicines and physical therapy. If these things doesn't help, then they will go over the MRI to see how badly nerve is pinched and what's the reason for nerve pinch, either just arthritis or you have a bulging disc. And depending on that, they can talk about epidural steroid injection in the back, which is usually done in the operating room or under X-ray. If you just have muscle pain, that they can do cortisone injection in office. Otherwise, you will need more medical setup for epidural injection. And worst case scenario, if all these treatment are done, if pain continues, then last thing comes to the operation. But you might want to think multiple times before going to the surgery, because most of these problems are going to persist even after surgery, and you might want to keep treating it non-operatively. These are some back exercises. Mr. Amke can tell you more about these exercises, but back pain is common issues. So that's one of the problem. Neck pain is typically like a back pain. Basically, neck is also made up of vertebrates, what we call cervical spine. And the same problems, it can be either degenerative changes, which is wear and tear, or bulging disc. You get pinched nerve in there, muscle strain, and rarely infection. The symptoms here, the pain radiates in your arm rather than radiating to the leg. And each nerve distributes in different area of your arm. So if you describe that I get numbness in this area, we will know that it's a C5 nerve which is getting pinched. Same thing affecting different fingers. You will know which nerve is getting pinched, and the treatment can be done accordingly. The signs are, again, you get tingling and numbness. There is a test called Sperling sign where you press on the neck and the pain will shoot down in your arm. The treatment, same thing, apply the heating pad. Again, for the back and the neck, heat is better than the ice. Same thing, exercise, and the next slide will show some exercises. Here you can do a neck pillow or apply a cervical collar. They are also available over the counter. We forgot about same thing in the back. You can get lumbar support brace. Some of them are over the counter, or you can get it from Amazon. Same thing, over the counter pain medication. If that doesn't work, you call your doctor. They can call the prednisone, which is again the steroid, or the muscle relaxer, which can also help with your pain. Again, doctor will send you to physical therapy. That has a very important role. And then if symptoms keeps going, MRI can identify exactly which nerve is getting pinched, and then epidural steroid injection can be done, or nerve root injection can be done. And last thing will be the surgery if needed. Here is a picture of cervical collar, and here are some neck exercises. I think that's the end of my presentation. I'll be happy to take any questions.
Before we go for the questions, Doc, I have a couple of things to add up. We talked about everything about you, but we didn't talk about your specialty. His main specialty is surgery for hips and knees, and minimal invasive arthroscopic surgery, and fracture fixation. So I just wanted to mention that. So once again, thank you so much for a wonderful presentation. I think you covered pretty much all the joints, which is amazing. So we'll wait for some questions. If anyone has any questions.
Good afternoon. This is Ramona. Thank you so much for a really excellent presentation. And I was wondering if you could show the exercise for the knee slide once more.
Definitely. Let me pull up my screen again. And I will be happy to share it if you can leave the email address or something in the chat, and I can note it and I can send you the PDF. Or even
Oh,
Mr.
great.
Kawasari, he is a specialist in exercise. He can also help us with that.
Wait, that's him.
Okay, fantastic. I'll do that. I'll send you my email.
Okay,
Yeah, yeah.
Thank you.
you're welcome. Any other questions?
Let me check the chat. I think somebody else is starting off. Give me 1 second.
Hey, she put her email ID in there.
Doc, Ms. Ramona has put her email ID in there.
Okay. let me
And I
check.
think Mr. Talk knee exercise or the whole presentation.
We can share whole presentation. I think if that helps.
Perfect. Okay, sounds good. Sounds good.
Okay. I will type my email ID if you want to give it to someone. I will be happy to help if they have any questions.
far
Just
nobody has
call
raised
or
hand.
email directly, and yeah, we can consult on phone if something I can help on the phone. Definitely. Otherwise, they can come to the office.
Oh, great.
Yes. Yes.
I'm going to type my email ID right here, so I'll be happy to take any emails.
Perfect.
And as I said, since this February, I joined this group called, it used to be Colonial Orthopedic. Since it looks like most of our audience are Indian, I will let you know that that group is full of Indian orthopedic surgeons. Out of 11, 10 are Indians, basically. And we have been spread more on the Colonial Heights area. But now I started going to Chippenham Hospital. I will start Henrico Doctor from this January. And I will have clinic here on Broad Street, right across the Boomerang. So I can be closed on the West End as well, and happy to help. If you call, we can either see you in the office or I can talk to you on phone. Is that Janvi or Manvi?
Yeah, Janvi. She's already asked about Sky like 5 times. I'm trying to calm her down. I was telling her after the COVID, everything gets lifted, we should plan her for, yeah.
Certainly, yes.
They've been pretty good. The kids have been, I should say, they've behaved very well.
They did, yes, during this.
Yeah.
Yeah. Thank you, doctor, for your presentation. Have a wonderful evening.
Thank you.
Thank you. Thank you.
Thank you.
Anyone else?
Thank you. Bye-bye.
I think that's it, Doc. So once again, thank you all for joining us. Tomorrow is on Dr. Vasu Venkatachalam is going to present. Give me 1 second. I'll share the topic with you. Mental health during an outbreak. So he is also from VCU Health Systems. So please join us tomorrow at 4 o'clock. And then after that, we won't have any presentations for Memorial Day weekend. And following which, I think on 29th, we have a presentation by Dr. Green on stem cell therapy. So please join us if you have time. All these posts, like I always say, it's all going to be shared on Facebook page called Weekend Wellness. Please share it with your friends. These are great information. These are great exercise. I mean, if you can see like today's slide, we have so many exercise and everything. Great information for your friends, family members, loved ones. So please share it with them. I mean, once again, this is no cost for anybody. The whole idea is to spread knowledge during COVID. So thank you all for joining in. Thank you once again.
Thank you.
Thank you, Doc.